So with that, I'd like to take us to our first set of polling questions. So everyone that's here in the room or online, I'm going to walk you through some instructions on how to get in the loop on the polling process. So the best way is to go to your browser, whether it be in your phone, if you're on the web, on your computer, and go to pollev.com/NKF Alport. And if you go to this browser, it will automatically bring up the questions as we move through them. You'll be able to select your responses right on the screen. If you choose, you could also participate by text message. So to do this, who you'll send the text message to is the number 22333. In the body of the text message, you'll type in NKF Alport. And once you send that initial text message, that will register you in the system. And as we move through each of the polling questions, you'll be able to type in the letter response options. So for example, if we have A through D as options and we ask you to select one, you could select option B and hit send, and it'll register your response. And then lastly, there is a Poll Everywhere app. So if it's the same display that you'll see on the browser, but if you so choose, you can download the Poll Everywhere app and enter the meeting code NKF Alport and similarly follow along. So please go ahead and pick your way to participate and go ahead and kind of get in the system through one of these three options. This information will appear on the following slides as we move through the questions. So if you're still typing it in, don't panic as I move to the next slide. And so our first question, which has already popped up for all of you logging in, and one thing that I want to note as you're answering these, so you're going to see here that the question is, I am an individual with Alport syndrome or a caregiver of someone with Alport syndrome. As we just heard in the clinical overview presentation, Alport syndrome is an inherited genetic disease, so you might qualify for more than one of these. So for this response, what we want you to do is we're going to ask you to select to represent one person throughout the day. If you're a patient, please represent yourself. I understand you might be both a patient and a caregiver. In that scenario, we'd like you to please respond on behalf of yourself as a patient. You could also be a caregiver and be a caregiver of multiple patients. So in that situation, we ask you to select one individual to represent throughout the day. If, for example, there's two parents here that have multiple patients that they care for, you can divide and conquer and split up and respond that way. So please go ahead and respond to this question in terms of who you will be representing throughout the course of all of the future questions. And if anyone is having issues accessing the polling, please raise your hand and we'll send someone to you to assist. Okay, excellent. Glad to see everyone is in. We'll give you just another moment to respond to this polling question. This will reflect, all of these results will reflect the responses of those that are here in the room as well as those that are online participating today. Okay, so it looks like we have a good representation both across individuals with Alport syndrome themselves that are here in the room and online, more than half representing patients. And then a little less than half of you are caregivers and not a patient and are representing someone with Alport syndrome. Okay, so our second polling question is, where do you live? Again, we're just collecting some demographic information to help get a sense of who we have participating. The first four options are for the United States, A being from the East Coast, B the Midwest, C the West, or D the West Coast. And then we have some options for outside of the U.S., E being Canada, F Mexico or the Caribbean islands, or G somewhere outside of North America. So it looks like our largest contingency, maybe not surprisingly, given the location of the meeting, is the East Coast. So we have the largest representation from the East Coast. Then as we move across the country, about about a third of you are are from the Midwest, about 10% from the West, and 12 from the West Coast. And we also have some representation from outside of North America. So our third question is, what is your age? And so all of these questions, if you're a caregiver, you would be responding on behalf of the patient that you represent. So we want to know, what is your age or the age of the patient that you are responding on behalf of? The options are A, younger than 18, B, 18 to 29, C, 30 to 39, D, 40 to 49, E, 50 to 59, F, 60 to 69, or G, age 70 or greater. So what is your age, or if you're a caregiver, the age of the patient that you're representing today? Okay, so it looks like a third of you are either less than age 18 or are a caregiver representing someone that's under age 18. It looks like we have pretty broad distribution in the other age ranges, starting at 18, going through age 59. Drops off a bit for those aged 60 to 69, and then we have a few representatives of those age 70 or greater. Okay, again, responding either as yourself if you're a patient, or the patient that you're representing as a caregiver. Do you identify as a male or female? A or B? Give it a few more moments, see if we get a tiebreaker here. Oh, there we go. All right, so all right. We're pretty equally split, very close to 50-50 of representing patients that are male versus patients that are female. Okay. So these will shift, so as we move from question to question, that polling question will close. Okay. So our fifth demographic question is, what is the length of time since your diagnosis of Alport syndrome, or the length of time since the diagnosis of the patient that you're representing? Options are A, less than 1 year ago, B, 1 to 2 years ago, C, 2 to 5 years ago, D, 5 to 10 years ago, E, more than 10 years ago, or F, if you're not sure the length of time since your or the person that you care for is diagnosis with Alport syndrome. Okay, so as the final results are trickling in, I think we have a very overwhelming representation from those that have been diagnosed for more than 10 years. About a fifth of you being diagnosed 2 to 5 years ago after that. Some good representation from 1 to 2 years and 5 to 10 years ago. And a little representation of those recently diagnosed less than 1 year ago. And nobody responded that they were not sure about the length of time since diagnosis. Okay. Now, question 6 is, did you receive a diagnosis of A, X-linked Alport syndrome, B, autosomal dominant Alport syndrome, C, autosomal recessive Alport syndrome, or D, if you are unsure of what your diagnosis is? Give you just a few more moments. It looks like we have about 2/3 of you here in the room and online representing individuals with X-linked Alport syndrome. About a fifth of you are unsure of your diagnosis or the diagnosis of the person that you care for. Just over 10% representing autosomal recessive Alport, and it looks like we actually do have a couple, maybe 1 or 2 individuals representing autosomal dominant Alport syndrome. Okay, and our final demographic polling question, and this is, of course, again, for either yourself as a patient or the person that you care for. Please select whether you are A, currently on dialysis, B, not currently on dialysis, and this is also, sorry, I select all that apply, I believe. C, a kidney transplant recipient, D, not a kidney transplant recipient, and E, a kidney transplant recipient and currently on dialysis, for example, having a failed transplant. So please select those that which apply to you. Okay, so it looks like the largest experience represented is by those not currently on dialysis. However, we do have a fair amount of experience of those that received a kidney transplant. And then we actually, it looks like, have some experience with those that have had a kidney transplant and but are currently on dialysis. Certainly we'll want to hear from the range of these experiences as we dive into our different topics. So thank you for participating in the polling for our